Hello, my name's Adam Coldwells. I'm the Chief Officer for Aberdeenshire's Health and Social Care Partnership, and thank you very much for watching this brief podcast about our budget for the 2017-18 financial year. We had an integration joint board meeting yesterday and the IJB agreed the budget for next year, and that is for £276 million to deliver all of the services that we deliver within Aberdeenshire. Although £276 million is a huge sum of money, it will undoubtedly feel very challenging for all of us within the Health and Social Care Partnership to deliver all that we do within that budget envelope. And that is what I wanted to spend just a few minutes speaking about. In order to deliver a balanced budget by the end of next year, we will all need to be part of working towards our financial position as part of the great work that you all do every single day. The budget that we presented to the Integration Joint Board was based very, very strongly around the strategic priorities that we've previously identified. It's really essential that we build our work around that progressive view of how we will deliver services long into the future in a sustainable manner. In terms of a brief message for today, there are really two key things that I want everyone to think about as they work and contribute towards our budget position. The first is the idea of how we all work day in, day out, both efficiently and with greater productivity. We're undertaking an exercise in the south of Aberdeenshire, in Kincardine and Mearns area over the coming months to look at how we explore a productivity in a different way. What is it we can achieve as the teams come together, all the different professions are working together in this different way that we're creating through health and social care integration? I hold great hopes on that. Some of the very initial work we've done looks very promising. I think it's promising for two reasons. Firstly, for practitioners, you'll be able to spend more of the time doing what everyone tells me they enjoy most, i.e. working with their clients and their patients more and more of the time, and us trying to remove some of the bureaucracy that people currently spend time on. And the second bit is, as we do that better and better, I know that our efficiency rises, and therefore our ability to do this good work will be more affordable within the envelope of money that we have. The second key theme, if that first one was the efficiency and productivity, the second key theme is the idea of how we redesign services. This is not new to anyone. We spend lots and lots of time redesigning things so that we have a long-term future for the delivery methods of what we do. And again, I want everyone to think about this, think about it within their own profession and really crucially within their integrated team. What are the things we can do that allow us to redesign the pathways of care and make those more sustainable for our long-term delivery model? I think we've had a great example through the virtual community ward, which many people, but not all, have been involved in over the past year. The virtual community ward, where people take every opportunity to work together around the most vulnerable people that we have, has shown great results. We've avoided many people being admitted to hospital when in our old model they would have been admitted either locally to a community hospital or indeed to Forester Hill and Aberdeen Royal Infirmary. The initial results look incredibly exciting, and if we can continue that and redesign other things in a similar way, then actually we will manage very well within that envelope of £276 million. My overriding message is to ask all of you to be part of this. Every single person that works for us in the partnership to join in and be part of delivering not only all the good care you do anyway, but to think, how do we do that within the financial envelope that we have available to us? Just finally, I'd like to take us all back to that guiding vision, just very, very briefly, and to remember the 5 key aspects of our vision. The first, that we use an asset-based approach. Secondly, that we deliver high quality services. Thirdly, that we do things in a person-centred manner. Fourthly, that we support people to be as independent as they can be. And finally, to keep people in and as close to their community as they possibly can be. Please use that vision as the pegs of how you do your work every single day. If you want to ask anything, please either get in touch with myself or with one of the partnership managers or the location managers, and we'd be delighted to hear from you and for everyone, as I say, to be part of this real team effort across Aberdeenshire to support our work within the financial envelope that we have available. Thank you very much for listening to this podcast. Goodbye.